Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hi, Jess.
So today we are going to talk flu, which is perfect because we're in the throes of flu season. The clock is ticking, so let's get to it. First and foremost, Dina, how is the flu spread?
So flu viruses are spread by tiny droplets made when people cough, sneeze, or talk. Or it may be even spread by touching an object that has flu virus on it and then touching your mouth, nose, or eyes. So that's why we always recommend covering your nose when you're sneezing and religiously washing your hands.
All right, so that's how it's spread. But what are the symptoms of the flu?
So the flu virus and the symptoms can range from mild to severe and even can cause hospitalization or death. Typically, what we do see, though, however, now is fever, chills, cough, congestion, sore throat, body aches, headaches, fatigue, and being tired. And right now, I'm actually seeing a lot of kids with vomiting and diarrhea with the flu. And just because you don't have a fever doesn't mean that you don't have the flu. So you should still, if you're not feeling well, be checked out. Now, the flu can also cause some more severe complications, such as sinus and ear infections. But the other thing we always look out for, if the fever is persistent or the cough's getting worse, is pneumonia. Other serious complaints, which are rare but can also happen, include inflammation of the heart, such as myocarditis, brain inflammation, encephalitis, or muscle tissues inflammation, which is called myositis.
So when does it become an emergency?
So you should always see the doctor right away if your child is having fast breathing or sucking in the muscles on their chest, which is called retractions, to breathe better. If your child is having chest pain, wheezing, obviously looking blue, is dehydrated, which means they're not having wet diapers every 6 to 8 hours, or no tears when they're crying, a sunken fontanelle, is acting lethargic. If your child's having a worsening cough or fever that's persistent for more than 3 to 5 days, over 101 in older children, and any fever in young babies over 100.4 rectally, is also an immediate call to your doctor.
Are there any treatment options for the flu?
Yes, there are. So when treatment is started within about 2 days of becoming sick with the flu symptoms, there are antiviral medications that we can give you, such as Tamiflu, that can be prescribed by your pediatrician and can lessen fever and the flu symptoms and often shorten the course by about a day or so. So, of course, we also recommend supportive care such as rest and hydration or Tylenol, Motrin if age appropriate, and just staying home.
Obviously, these things do not sound pleasant. So are there ways to prevent the flu?
Yes, there definitely are. So we, of course, recommend to get your flu vaccine annually, and babies can start getting it as soon as 6 months old. So the first time a baby gets the flu vaccine, they need 2 doses of it separated by a month. And then the year after, they only need 1 dose per season. The vaccine has been shown to reduce the risk of serious flu complications that can result in hospitalizations, but it doesn't, however, mean that you will never get the flu. It just means that you will be, if you get the flu, it will be less severe. And of course, everyday measures like staying home if you think you are sick with the flu, covering your coughs and sneezes, and religiously hand washing.
As a public health scientist, I love that you mentioned the vaccine and happy that you really emphasize that the vaccine is not intended to prevent transmission altogether. It's just really intended to prevent us from getting super sick and requiring hospitalization or worse. All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.